Today we are talking about beauty standards and how they're changing. For the longest time, there was this myth that something called the golden rule defined beauty. Certain measurements in your features, certain ratios were the mark of true beauty, this myth went. And of course, they conformed to white beauty standards. Well, our next guest is working to change all that. Dr. Michelle Henry is a board-certified dermatologist and dermatologist surgeon who's helping to define what we consider beautiful, bringing race and ethnicity into the conversation. Dr. Henry is also a consulting dermatologist for Kiehl's and an advocate for inclusivity in dermatology. I'm excited to bring her in. Thanks for being with us. I'm so happy to talk to you.
Happy to be here. Thank you for having me.
So I thought we'd start off, I have a bunch of audience questions, but let's start off with a broader conversation about beauty standards, something that I've been fascinated with my whole life.
Yes.
Would you explain to us, what is it called, the golden rule, and how did it come about?
So yes, the golden ratio. It is a ratio that allegedly has been around since ancient times, and Leonardo da Vinci used it to create his masterpieces. And the number comes out to about 1.6. And if we apply that to the face, that means that your face is about 1.5 times long as it is wide. That your upper lip is smaller than your lower lip. And so it's using this number and applying it to different proportions of the face to come up with this beauty and to come up with what would be ideal in terms of the proportions of the face. And as you said, this is not widely applicable. So it doesn't apply to different races. And so I often tell my patients, you know what, my lips are 1-to-1. That is anti the golden ratio. And I think they look okay. Whenever in medicine we're applying, mathematical equations or trying to apply science to something that is truly kind of a social construct. And we're trying to apply numbers and trying to be very exacting as a measurement of someone's fitness, someone's beauty. That's a very dangerous area that we're stepping into. And that's why I kind of push back on this number as much as I do.
How are you seeing this change?
So it's changing because we're having this conversation. So, in medicine, there are many things, especially things that we just accept as fact, and we don't push back on research because it's sacrosanct. It came before us. It is sacrosanct. That is the standard. Medicine is very much like the military. There's this hierarchy. We respect things that came before us without always challenging them in the way that we should. And before I started to become more critical of it, I'm sure there are moments where I was teaching this ratio because it's what I was taught, until I had an aha moment and thought to myself, but wait a minute, I'm looking at a face that doesn't match this. I have many beautiful patients who don't match this. There are countries where the average citizen doesn't match this. And so, I think we're starting to have conversations about the fact that a lot of what we've been allowing ourselves to hang our hat on as fact has inherent bias, and that we really are going back and looking at our research and redoing the data and looking for that bias, so we can be in a better place, not only in beauty, but in all of medicine.
Let's talk about that for a minute. In what ways do you think that people of color, people who are non-white ethnicities, have been impacted by these beauty standards over the years? If you be a surgeon.
Absolutely. It's beyond the fact that it affects patients in the office when they're looking to have these unrealistic beauty standards. It's a psychological damage of the standard, them looking at themselves every day and realizing this is a standard that no matter what I do, I can't meet. And it really feeds this idea of I'm not enough, I'm not perfect enough. When I step into a space, I am inherently flawed. And so I think the psychological damage is huge. But then when you come to our office, you're trying to have us force you into an ideal that we shouldn't even hold, And so I think above what happens in the patient's in the office, anatomy is anatomy. There's only so much we can do. I think the psychological burden is far bigger than what happens in the physician's office.
If it were up to you, how do you think how would you have dermatologists talk about ethnicity and different beauty standards when they're interacting with patients?
So I think that what informs, like we said, beauty is our idea of beauty is like this social construct. It's not this exact thing. There's no science behind it. It's informed by your ethnicity. It's informed by your environment, your culture, the media you consume, your family members, who you love, your sexual orientation. And so I start with a conversation of what is your idea of beauty? And I let my patients know there isn't a standard. And so you want me to make you look beautiful. And in my mind, beauty is harmony, right? But the harmony that I want to attain for you is informed by your needs, your wants, and what makes you feel powerful and beautiful and strong. So I always start there, and I don't use harsh ratios or tell them what's perfect. I let them inform me first, and I tell them what I can do with my tools and my techniques and their anatomy to get them to a place where they're happy.
We know that Black people make up 14% of the US population, but just 3% of dermatologists. How do you think that reality has impacted patients, especially Black women who go to see overwhelmingly white dermatologists for beauty improvements over their life?
Yeah.
And what do you hear from your Black patients about having a Black dermatologist treat them?
Yes. So I will say this, a lot of my colleagues, a lot of my mentors, many of them are Black and many of them are not Black that taught me about Black skin. So it's not, you don't completely have to be a person of color to teach Black skin, but of course we have a particular investment, many of us. I think it's important because patients, it's a difficult conversation to have. So in the way that I teach my students, I tell them we need to be able to talk about race and culture as effortlessly as we talk about elevated blood pressure, and we're not at that place yet. And so because, culture is language, and what is more important than language to medicine? We have to get a history. That makes it very important to patients that they speak to someone who understands their language. And so it's definitely necessary because, there are a lot of studies that show that patients at least perceive their outcomes to be better when they are when they're matched culturally with the doctor oftentimes. And I think that might be from, maybe it's not, I think it's more from that sticky moment of feeling like they were heard. So I think it's absolutely important. It's absolutely important. We need more physicians of color for many reasons, because it's important that we teach others, that we teach culture, that patients feel comfortable there. When it broader, even beyond our clinical practice, when we start talking about research, there aren't enough patients of color reflected in our research, and that's because in the history of this country makes a lot of patients of color, they feel unsafe joining large-scale research projects where they don't have a person of color as a principal investigator. So that's another reason we need more dermatologists of color. So at every level of medicine, science, research, we need more physicians of color to make sure these patients are safe and appropriately represented.
And how do you think being one of the rare Black women in this field has affected your career? And have you felt your experience was different from other people?
I think, of course, yes. You're in spaces where you're the only person there. And, with like I always say, when you're given a seat at the table, you have to use it. I'm not just there to take up space. And I take that as a very important responsibility and a privilege that I know many aren't given. So that does make your experience different. Sometimes when others are learning, I'm teaching, and that you learn very early on in your career. There are certain things you're going to have to carve out for yourself, certain resources you're going to have to seek for yourself, certain mentors you're going to have to find on your own to make sure that your education reflects what you will see. Because as a Black physician, I'm going to see Black patients. And so I have to be prepared, even if my textbooks aren't there to prepare me. So it, of course, shapes your experience. But I think anyone, any person of color, any minority, any even woman in a male-dominated space realizes that you kind of have to wear your raincoat, try to let it run off you, don't internalize it as much as you can. Know that your path will be different, but know that you can do it. And so that was my path. I definitely had hiccups, but.
Do you think that we're evolving into an arena sort of where there's sort of a beauty standard for Asian women, and then a beauty standard for Black women and Latino, and then white women, and there's sort of an ideal in various categories that different women, depending where you fall, are working toward? I
think so. And I don't necessarily, when I say beauty standard, even just that phrase makes me a little bit uncomfortable, but I think so. And I think that is healthier than just having one standard. But I think even that needs to be wider, sometimes even in Black communities, or even, let's say, East Asian communities, sometimes the standard may not be one that reflects the majority. So we really have to make sure that we're looking at the standard in every space to make sure it's not this rigid thing that's pushing certain people as outliers and not letting them feel that beauty is theirs as well.
It's interesting because I was talking to a friend of mine who was saying that I don't have kids, but she has kids, and that they're always putting their face on these social media platforms and putting a filter on. And whenever they see themselves, usually it's through this filter, unless they're looking in the mirror.
Mm-hmm.
And these filters are deciding what pretty is, right? And
Mm-hmm.
so now they're doing different filters for different races. But I wonder, how do you think about the problem beyond that? Like, if we're saying, well, beauty depends on all sorts of these other identity factors,
Mm-hmm.
how do we even say there is a beauty standard? Why isn't how I came out of the womb beautiful?
You're absolutely right. And so I ask my patients, what makes you feel good? You know, you try, it's hard because one, I'm in an industry where I think there is, you know, that we talk about positive toxicity, right? When you're telling someone, oh, you're fine, you're fine. But if a person does not like this and I can do something very small and safe to make them feel better, we should. So I don't subscribe to the idea of like, I want to be very positive, but I don't want to belittle women who want to feel empowered through making a decision to make themselves feel better. But we also have to guide them in a path that is both medically sound and psychologically healthy, right? And that's
Mhm.
kind of the balance that we're taking on. So it's a difficult conversation to have, you know. We're all amazing and beautiful in any state, no matter who you are. But it's a very personal conversation as to when I look in the mirror, do I feel like my best self? Do I feel like when I walk into a room I'm confident? If there's a small thing I can change safely, should I do that? My answer is yes. But it becomes that conversation of how much do you change? Why are you changing it? What's your true motivation?
And do you have advice for parents or even people who get agitated because they see themselves through a filter and then they look in the mirror and it doesn't match?
I think what's important for everyone, and this is why I think inclusivity is important, is to show your kid, no matter what their background, all kinds of beauty. Because when we realize there's one type in anything, even if that one type reflects us, we realize that we're placing value on with very strict boundaries. Eventually, you're not going to fit within that box, right? And so I think it's really important that when we're teaching our kids about beauty, that we're helping them appreciate all types of beauty because we're helping them to accept their own and telling them that others are okay. And so it's just about having this conversation as like, you know, that your beauty is unique and what makes you feel best is important, and it can be whatever you make of it. And beauty changes, trends change, but it really is whatever you make of it, and that will endure. What makes you feel good will endure, but these trends won't.
A couple audience questions.
Mm-hmm.
Is there a good treatment for vitiligo?
Vitiligo is very tough. So there are a lot of treatments that we can try, and the list of our tools are ever growing. So everything from topical steroid treatments to topical non-steroidal treatments to even more aggressive treatments that we once reserved for even like more aggressive autoimmune conditions we're using. There are oral treatments that we use. There's light therapy that we use for vitiligo. So, it's ever growing. Oftentimes we have to use multiple treatments. So especially in patients that have a more severe case, I'm almost never using just one treatment. I'm often using lights and two different creams because it's all about suppressing the immune system in that area. So there are some fantastic treatments, but every case is different. And as I tell my patients, it is an exercise in patience sometimes. But that's why it's really important to see a dermatologist, try to treat it quickly, and at least get an understanding of your prognosis so we get the best chance to make you better faster.
What is the best sunscreen for dark skin tones that doesn't leave a streaky look?
That's a great question. And I always say it is a great time to be alive for sunscreen. We have many different options, both chemical and mineral. And that mineral thing was a tough thing for patients of color for a long time because we just didn't have mineral sunscreens that work. Am I allowed to say brands?
Yeah.
Yes. So there are lots of brands, and lots of companies that I'd like to have great sunscreens for skin of color. So there is, CeraVe has some great ones. They have their hydrating sunscreen with sheer tint. They have their that one is mineral. They have a ultralight moisturizer with SPF 30. That one is chemical, but really, really elegant. Supergoop, one of my favorites, has their unseen. So just as it says, it's unseen. So really elegant on skin of color. Who else? Olay even has a new mineral that is good for skin of color. Kiehl's has their daily fluid defense. That's great. I'm just gonna list all the brands. Olay has a great one. I mean, there's so many. There's so many right now. EltaMD, Skin Better Science has a tone adapting pack, and then last but not least, powders. So there are some great powders. So another question I get is, how do I reapply my sunscreen after I have on makeup? There's some great powders that are SPF 50 and come in all different skin types.
And you put that on at the end after you've been wearing makeup for a day?
Yeah, so let's say like the biggest question is, well, Dr. Henry, you told me to reapply my sunscreen every 2 hours, but I have on my makeup. What am I going to do? So the answer is to use a powder. So like Color Science makes one, Isden makes one, Jane Irondale makes one now, but they're powders that are mattifying, and they're also SPF 50. So that's a nice way to reapply.
Are serums worth it? And can you apply a peptide serum with a vitamin C serum in the same routine?
Absolutely, serums are worth it. So serums are basically, they're like boosters. So they're packed full of, they're concentrated active ingredients. So if you actually have a targeted skin concern that you want to treat, a serum is one of the best things you can do, because you're going to really get those actives where you want them. So vitamin C is often kind of a labile sort of ingredient, meaning like it doesn't play well in the sandbox. There are lots of things that can activate it. But there are a lot of really stable vitamin C's on the market nowadays. So I don't see why you wouldn't be able to apply a peptide containing cream. Now, some things you don't want to mix with your vitamin C. You may not want to mix with a retinoid, because they exist better in different pHs. But something like a moisturizer with peptides should work well with your vitamin C.
What's your suggestion for dealing with maskne, acne you get under a mask?
Yes, so I could start a maskne clinic at this point. I've seen so much maskne in the last year. So I will claim to be a maskne expert. So maskne, it's kind of counterintuitive. So when we see acne, our first instinct is to just get rid of it. We want to bring out the big guns. We want it gone. But that's not what you want to do with maskne. So maskne is called, the medical term is acne mechanica, and it comes from friction. And actually, we see this not only with masks, but with football players. They'll see it in their chin strap. And so
Yes,
athletes, yeah, and so it's from that friction. That friction causes inflammation. And in addition to that inflammation, you have to think about the dirt, oil, and debris that's also getting pushed into your pores because we're wearing masks. So I know. So it's about gentle cleansing, so hydrating cleansers, because we don't want to disrupt our skin barrier. Lower concentrations of acne-fighting ingredients, because again, we don't want to disrupt our skin barrier and contribute to more inflammation. And you just making sure you're wearing clean masks, you're cleansing your skin midday to get rid of oil, dirt, and debris that might contribute, and then patience and time.
And finally, do you have a good suggested treatment, like a laser, for evening out your skin tone for any skin color, or does it really depend?
Yeah, so that's a big part of what I do as well. So some of the lasers that I love, I mean, there's a laser called the Aerolase laser that was really made with skin of color in mind. And so it treats acne. It can help to even out the skin tone. There's another laser called the Clear and Brilliant laser. A lot of people have heard of the Fraxel, which is a heavy-duty resurfacing laser, which we can use on skin of color as well, and I do sometimes for acne scarring. But the Clear and Brilliant is a really great introduction, very safe for skin of color, and also will help to resurface a little bit. I do a lot of microneedling and radio frequency. That is my workhorse, because it's colorblind, so you can really amp up the energy to get rid of scars on any skin type. And then I'm a huge fan of chemical peels. Whenever I do a lot of lasers, and I speak on lasers a lot, so when people come to visit me and I say peel, they're like, where am I? But I love, love, love peels, especially for skin of color. Whenever we introduce energy into the skin and with a laser, there's a tiny, tiny risk, right? Slightly less so with peels. So I use a lot of peels in the office, and peels are great for evening out the skin tone. So I use them a lot.
That's great. Dr. Henry, you're fantastic. Thank you so much for your time. I would love to do this again.
I would love to. Thank you. Thank you for having me.
Thanks so much. And tell everybody where they can find you.
Yes, so I'm Dr. Michelle Henry. On Instagram, I am at Dr. Michelle Henry. And I practice in Manhattan, New York, where I do all things dermatology and aesthetics. So you can find me on my Instagram, and I answer questions there. And we're pretty responsive as well.
You really are. Thanks again. Look forward to talking to you.
Thank you. Have a good night.